My screen is visible, madam?
Yes, sir. Perfectly visible.
Okay. Good evening, friends. I am Dr. Charan Patro. Today, I am going to talk about the how to, as a clinician, how to practice and how to make cancer practice or oncological practice very easy. And it is a like a motivational talk to mostly to the newcomers. And I'm those are just coming out of the post PG session, and it is for them only mostly. And just it is a my thought, my principle of taking care. If you like it, you can share it, but don't take it personally. And just it is a motivational to the my juniors who are coming, just passing out of the MD or DNB curriculum. So this is the so as a doctor, always it is a we uh, uh, after passing the MBBS, we thought that, oh, every tension finished. After passing MD, every tension finished. But after MD, the actual tension starts. So whether we should focus on the clinics, whether we should focus on the academics, whether we focus on the publications, whether we focus on the management, or in the focus on the building in a hospital, whether focus on the family. So how to take care. So this is the important thing in a doctor's life, to how to balance in all these things in a day-to-day practice. Doctor, as I think, yeah, always doctor is a blessed creature in the world, who is always taking care of the doctor is a privileged to take care of underprivileged. Underprivileged is a not on the financial, it is underprivileged is the socio-economic status, underprivileged about the disease, underprivileged the sufferings, underprivileged with pain. So doctor is so much privileged to take care of the underprivileged. If you do the logical meaning of medical logo, that is wings and human and snake, if you see the actual meaning of the doctor logo is a doctor restores peace and save us from the evil. And I brought a new car, and I put my logo on the car. My friend asked, you are always advertising, why are you putting a logo in your car? So I told, if you are not in the, if you are in the, if person, somebody is in the need of in a medical emergency or traffic accident, if he say car with a doctor symbol in it, so they may ask you for the free medical emergency help, save life. Utilize of the professional competency, and it is the very important. Putting a doctor's logo, it is not advertisement, it is a social help. Whether can somebody can spot you, just please help us for the in this medical emergency. So many meanings of doctor. I have gone through the internet. Deep feeling, observing eyes, caring heart, training hand, open minded, and really human. So I teach my students, you see the patient, you develop your clinical skills by seeing the patient. You can know what is his problems and everything. Then most of the, by inspection, palpation, and talking, your most of the things gets solved. And some people, it is defined as a doctor is a determined, observant, cheerful, tidy, open, and responsible. Some people is a decisive, optimistic, calm, tough, and open-minded and rational. So the some people, there is a doctor for the obedient, character, tolerance, optimistic, respect, and responsibility. So they defined as a doctor in a many instances. But after the passing the MD DNB curriculum, what should be a doctor called? He should be good at a profession, good at a family, good to colleagues, good to patients, good to management, good at a practice, and good at academics. So if you all these things come about together, I tell my people that doctor is not a your only profession or you a degree holder. You have to be very good at your all curriculum, then it is a totally called as a doctor. So if, as a doctor, the family, social, and personal expectations are always high, and we should keep our expectations high. You don't think that we should not think that why I should put my expectations low. I should think I should be more ambitious as a doctor, and as a more responsible person. So what happens after the getting the master's degree, and so people think that everything finished, now we have to go to the practice and start earning. So what do we do? We just find a job as a senior residency or something like a job. And if somebody gives a job, people will get excited. Oh, okay, I am doctor now, I'm a consultant now, I'm a professor now. No, so my job is over. After that, your people ask for the marriage, and you will choose a housewife or a professional wife, and you have to do the titration, whom should I choose. And so you have to choose a person or life partner like this, so who can balance your life. If you are a profession, suppose you are a doctor, whether you need a doctor in a housewife, you should do the many calculations and everything. It is not a single contact job where just it is a like love at first sight like thing, not like thing. We have to choose everything, we can balance our life, because if your family is in peace, you can give a professional contribution will be more. So if you want to go for a book, you want to write how to, if you are new to the this going for marriage, you can read my this book, or for a few days it will be on the, it will getting released. And after that you get married. After marriage, just you are going for a honeymoon or something, some romance period. After romance period, you are describing a car, and after 1 year you will have a baby. After baby, you may opt for two babies, and usually family finishes after two babies. And then whether before or after, you will have a big house or apartment or individual house according to your the affordability. But we think that our destination finished. So actually our, as a doctor, most of the 95% of the doctor, they think that I have a wife, I have a car, I have two kids, I have a good profession. Now I am a very much complete man, and I have a my destination is done. So really, it is the original destination what we expected. Your ambition is stopped here. No. So plan it and do it. It is not like just getting this, you're putting your expectations here. Do not limit your expectations. Think at day one, start your own hospital, hire or partner in a old hospital, ask the government for land, go ahead, be your own boss. So this, the your think your expectations and destination is not stopped here. You have to, after passing the MD and DNB curriculum, you have to think that after coming 30 years, what should I do? Whether I should own a hospital, or I should own a partner with a hospital, or I should go for a government job. And you think that coming 30 years, or you want a government job, or government a private job, or a whatever thing you think on. So it should not be your thoughts should not be stopped after the passing the MD. Your thoughts started from the passing of the MD, and think what we are going to do in coming 30 years and 40 years, so that it will give you a good correct good things. If you see, this is a very good time things. Value of 1 year, we ask for the exam failed student. Value of 1 month, ask a mother of a premature baby. Value of 1 week, ask the doctor a weekly newspaper. Value of 1 day, ask a daily laborer. Value of 1 hour, ask the lover who has waited for beloved one. And value of 1 minute, ask a person who has missed the flight or train. And value of 1 millisecond, ask a silver medalist in an Olympic game. So if you see these things, this is the value of time, you will understand. But another thing, if you don't think at a MD level or DNB level or post graduation level, we don't know the value of a life. So you will not able to estimate the value of life. So my aim to tell you is that you think what we are going to do at your coming 30 and 40 years at the MD and DNB exit. So people are happy with a salary, though usually I am happy. I'm in a government job, or I'm a private job. I'm getting this much of salary. It is a happiness. I am getting it. But the reality, just salary is your. They are giving the salary to forget your dreams. So never stop your dreams to come. Stop. Dream it. And the very good quotation I tell, to see the dreams, you have to awake and do the work. But the dreams never coming in the sleeping mode. These dreams never coming in the sleeping mode. So if you are if you want to fulfill your dreams, you have to be awake and do good things, or do whatever you want. Don't be happy with whatever the things we have. So how to improve your practice? If you are coming to the practice, how to improve? So patients are your assets. So from the day one when you started practicing, you just to keep the data, all patient record from data day one to Excel sheet. You don't know, because in oncology practice, every 3 months, 6 months, people will come follow. After 10 to 20 years, 30 years, you may have a very big data to keep in them follow, and it will give a good satisfaction how many patients are going more than 5 years, 10 years. So from the day one, you keep all patients record from the day one to total life. You maintain a Excel sheet. So some people they think that if I don't give kickbacks, people will not send the patients to me. And how will you run? There are already established doctors are there. Why they will send to me? And there is lots of things, permutations, combinations in coming to the person's mind, how to lead this practice. What is kickbacks? Kickbacks are any illicit payment mode to someone in return of soliciting transaction or appointment. So I really I hated the kickback. uh, I I hate it. So how to acquire patients? See, in cancer treatment, people require 2 months of radiation, 2 months, three long time chemo, long time radiation surgery. So it requires a 5 to 6 months. If you give them free food and free shelter, ask your management to put a dormitory and ask them to live there and give free shelter and free food. And so they definitely, it will, the people will come to patients will come. And if you are taking care of the logistics, and people will the patient will be a free flow to your institution or to you, so it will be taken care. So how much it cost actually? So this, if you see the uh, sometimes the poor patients, though don't have money, how they will help you? How you can help you? There are various things called crowdfunding. They're like Impact Guru, and there are lots of things in on social media. You can see, though you can help them by crowdfunding. You can give them government schemes like Aishman Bharat Yojana, or in every state has a various schemes also. Like in Andhra Pradesh is Arogya Shri, Orissa there is a Biju Swasthya Kalyan card. You take the advantage of all these cards. People, a person asked me, sir, you can join in our hospital, but we are not going to treat the scheme patients. I told them that is one day everybody will come under scheme. If you don't treat scheme patients, your hospital is not going to be survive. At last, after 3 years, they accepted the schemes and they started the treatment. Sometimes don't you will not find the uh, money from the adequate from the schemes. You can ask for CM relief fund or PM relief fund. And those are keep tracking your cured patients. Those are happy donation. You can take from the donation and cured patient for your patient develop. Those are poor patients. And physical help from the cure. Some cured patients, they are asked, sir, we are cured and we want to help the people. So you will get a manpower manpower and money power. Just you help your own patients. Apart from that, you can take motivating the local rich people, and they can donate machines. Even it is mostly useful for your local government hospitals. You can, but how to acquire more patients? You can do with MOU, MOU with nearby hospitals. They can, if you are a oncology hospital, they can send the cancer patients to you, and some patients you can send the multi-specialty and cardiac nephrologist. You can take the, and MOU with government hospitals. All government hospitals might not with all facilities. You can tie with MOU with government hospitals. And there is a very good curriculum. There is a called cancer awareness at Anganwadi workers. So ask your hospital team to go to the every Anganwadi workers to present a cancer awareness program. But lots of Anganwadi workers, you were not able to do these programs. You cannot attend every time. So what you do? You arrange a TV and you take a pen drive your recordings and display there in front of them. So they will get cancer awareness, as well as when there is a cancer problem, they will contact you. Send your videos and sensitize your hospital team to do that. So if you patient, if you are going to help the patient flow will be there. You give the free food, free lunch, free dinner, and free shelter. If it is comes 100 rupees per day, if you really communicating with some people, dormitory staying 100 per day, and monthly cost is 6,000. But if you are giving kickbacks, it need more money, 10,000, 20,000 kickbacks. When you give, it is not needed. So if you are giving free shelter, free food, and you are really taking care of the patients, automatically there will be a patient flow into your in your name or in your to your hospital, and it will be helpful to the patients. Main thing is the people, you are taking care of the logistics, they will get benefited from these things. So apart from that, if you go to the practice, out of the practice, you will have so many journals, daily updates, increasing number of patients, so many follows, inaccessible to paid journals. There is a competition about the colleagues, meeting the expectation, self, patient, and boss. How to handle these hurdles? So these are the so many journals in the world. How to get updated? So there is a called QXMD, read by QXMD app. So if you download this app from your Android or Apple, in this app you can select your journals, which journals you like, select your keywords, create files, free articles you can download, you can share to mail directly, save for future, and make your favorite. So this is a very free website. This is a free Android app. You can download here, and you can the website you also download. When there is a new article comes to your thing, it will automatically go to your mobile pop up in the screen, and you can know the all the, so like if you can as oncologist, red journal, green journal, JCO, Lancet Oncology, seminars in radiation, these 5-6 brachytherapy journal, contemporary brachytherapy, you can these 5 things you put automatically. Any single article comes, it will pop up, and it will make you update every time. PubMed, people are very less using nowadays, and you can search, many searches are there. PubMed, you can how to use a PubMed tutorial. There is a very good things. You can go to the YouTube and do the search. Sci-Hub, sometimes we are not getting the free articles by things. You can get this Sci-Hub site where you can put the PubMed ID or DY. You will get the though it is a corrupted site, but it is used, the people use regularly for this downloading any form of free articles. So this is the PubMed ID, and if you put this PubMed ID, you will get the full paper here. Now, for the radiation oncologist who is practicing, the target delineation is their bread and butter, and you have to contour that. So this is called econtour.org. You can go for this contouring side by side, case by case studies. You can go for the contouring pulse and everything. That will be very useful to you. Online calculators, sometimes some patient may ask, sir, how many days I am going to live? What is the role of adjuvant radiotherapy or adjuvant chemotherapy in my practice? So how whether chemotherapy is helpful. So there is a various, this is a breast cancer outcome calculator, cancermath.net. Another MD Anderson, various calculators are there. You can show the patients, these are the calculators showing that whether you need a chemo or need a radiation, what is the role, how many how much benefit will be there, you can use these calculators. This is even QXMD has a own calculators, and you can body surface area, creatinine clearance, everything you can available. Well, for radiation oncology, this is the equity2.com is a BD calculator, is very useful. And searching for a presentation, you can go by slide shares. Nowadays, slide share is chargeable, but for sharing the 400 monthly is not a big deal. In 400 rupees, they can educate. I don't think it is a very much costly. And searching for presentation, you can go for any presentations for slide sharing. You can save your presentation, download your presentations, and you can, there are PPT search engine also is there, it is free, and slide player is free, you can use that. And if you want you are not understanding anything what to do, go to the YouTube and see from the anatomy to professional practice, anything you can get even the YouTube with the demonstration. So this is the YouTube in the if you use in correct mode. So these are the various things, anatomy to professional practice, everything you will get in the YouTube. Google images, any images you are finding, we just finding out, calling the patients and everything. No doubt, anything, any images you type it, it will be available in the Google images. It is easily available and easily. Some copyright issues will be there. You modify it, something, make a color combination change, and I think this will be the helpful for you. Online CM is free. There are various online CMEs are there. You no need to pay anything. You do it at your home. You daily one CME around half an hour you can do. They will give the CME credits. The Medscape you can do the CME credits. I have a 2000 CME certificates, but I'm not doing now. You can do the med pages. You can go for the oncology site, and they will pop up in your website. And if new article comes, you can go, you can download your own certificate, you can put that will be very useful to day-to-day practice. Wikipedia oncology people hardly use, and it is a good things also you can use. Chemotherapy protocols, sometimes we are fumble, we are asked how to do the practical. This is the BC Cancer Agency. You can this is a BC Cancer Agency, you can all chemotherapy protocols detailed given. We no need to search in the if somebody is practicing breast cancer. Many patients other, you can take the protocols, type it, you just fill the BSA and type the amount of drug, that will be very fine. This is the BC Cancer Agency. You can go for the all cancers. Another app is called Oncologist app. You can go through this Oncologist app also. This is the thing you can download stagings, outcomes, and you can utilize this Oncologist app. Books download, you can Library Genesis, anything, you can go for the book download here. Online storage, you can do in the Dropbox. Online converter, I love PDF. You can go for the any conversion from the documents to PPT to PDF to PPT to PDF, PDF to PPT, anything you can do. Academic groups, there are many academic groups are there, WhatsApp and Telegram. And there are the I have made international task force groups from brachytherapy, cranial SRS, lung SBRT, liver SBRT, pancreatic SBRT, prostate SBRT, spine SBRT. You can take. You can, if you want to join, you can send me request in my email or my WhatsApp me. So you can join this task force. International resource groups, I made this onco books, onco PPT, and radiation related, onco related question papers. So these are the books are freely available, and PPTs are freely available. I am also requesting those are already a member, they can upload their PPTs and books for the help benefit of these students, benefit of the resource people, and society. I have developed one my favorite topic is brain tumor. Brain tumor patients. So I have developed a brain tumor clinic for Oncologist International Network. I given as a Bitcoin. If anybody is interested, they can communicate from the national, international through Zoom platform, and they can communicate with me. They can show their contourings, they can show their diagnostic tools. They can say the anything can discussion, and it is through Zoom platform. It is totally free, and every day they can communicate with me around 6 to 7 p.m. I have made a group of Radio Surgery Society of India. You can join. This is the Red Onco India group. You can join. Dr. Sarthak is the admin, and Young Radiation Oncology, Dr. Sain Paul is the admin, and Red Onco Telegram group, and Europe News, that new people they can join in this group. And I have I have been started one day full curriculum about the radiology and radiology, stereotaxic class, and brain tumor and target delineation. This four one-day curriculum I have developed. If anybody interested, they can contact me. I can go for the physical or physical class or online class for the target delineation, stereotaxy, radiology, and brain tumors. So after you are becoming so popular and everything, you are managing a crowded OPD is very tough. So how to manage this crowded OPDs? So you have to hire the assistants, either pharmacists or nurses or junior doctors. You have to then this is called multi OPD room, where there is internal communication through all the rooms. If you are really a big practitioner, put assistants in all rooms, let them take the preliminary history, and you go to the room to room. In this way, if you do that, I sure you can see 100 200% without any easy method in the in a single day. When I conference, just people think that we just go for enjoy. Usually we go there to learn. Always teamwork matters, and customer is your patient, and he is not dependent on us, we are dependent on him. And patient beyond is a beyond customer, it is not a customer. We have to give social support, you have to give the help, and this is the what a patient define the human. You must not lose faith in humanity. Humanity is an ocean. If a few drops of the ocean are dirty, then ocean does not become dirty. So always take care of your patient, help them. And this is the some onco.com, there is online consultation groups are also there. And always do a indemnity insurance. It is costing you around 12,000 rupees for 2 crores. So don't hesitate to do a indemnity insurance. We don't know which patient will drag us to the court and everything. We don't know when we do some wrong treatment, we don't know what to do. Always do a professional indemnity insurance. I can tell you the radiation oncology India, they developed the doctors professional indemnity insurance, and they will take care of for the attending the courts, advocates, everything. So this is the best thing you have to do in tension. If you don't show to your finger your colleague, always love your colleague, because they are your resources. When you are going out of station and everything, they will take care. So don't show to finger your colleague. Wrong deed for your own fraternity, do not disclose. Some patient came to you and said that that doctor treated wrongly. Never disclose these things to the patient. Whatever the God gives you, treat accordingly, receive the grace, and never scold your colleagues or fraternity, either homeopathy or Ayurvedic. Some people, cancer patients, will come down with alternative medicine. Never scold them and tell that okay, whatever happened, let's start from today. Do some charity, and best charity is the income tax. If you are really doing that, give some income taxes. Whatever the more income tax, automatically it will go to the various construction, school, roads and everything. It is hospital. That is the best charity, I feel, the income, giving the income tax. Inter-government hospitals, we know these are the various issues we suffer day to day. So I tell my people, don't complain, be a compliment as you're a part of the government. So always, if you go, donate something, chairs, some cots, some bed sheets, some medicines to your government hospital, they will run in your name. You can donate pulse oximeters, ventilators, beds, prescription pads, cleanings, syringe pumps, nebulizers, and help the doctor. If you have time, you can go and help them if they allow. Oncology cartoons, I have made oncology cartoons, and I am 90 volumes. You can download all the links in SlideShare, and this is the SlideShare chapter wise. You can go for this daily to day tips, and you can this oncology cartoons was nominated by BMJ Asian. And at home, switch off the TV. Most of the time spending at going home, switch off the TV. And what to do after you turn off the TV? Just to play with your family time. Do the work with your family, make fun with your family, take care of your kids, make them educated, and teach them. And these are my family, my parents, my mother, father, my kid, and my wife. I have a special thanks for them. Thank you, my all teachers who helped me to grow like this. And I thank to God for making me a doctor, and all dedication towards my patients. So if you work together, either enemy or things, definitely we will have a different world in this situation. So always take the and I in last slide I'm going to tell about, this is my website, drkanhupatro.com. So important links are there here, like PubMed, ISTRO, Astro, QXMD, Lancet Oncology. You just, if you want to for a single website, you can go for click these links. Automatically it will take you to another window, like up to date Sci-Hub, Dropbox. Everything is there what a clinician needs, oncology clinician needs. You can go for these things from the Gmail to ChatGPT. What I need, a oncologist need, you can daily to daily practice. Dear Casey, drkanhupatro.com. You can use my website for your daily practice. Thank you very much attending my class. And this is all about, it is just about the fun. It is not academic class. It is a fun teaching, and just motivational for the newcomers. Thank you very much. So anything you want to ask, you can ask something.
Thank you, Kanu sir, for your excellent presentation. And I should say, whatever you did in last 20 years for the oncology, you have summarized in your presentation. So it is definitely for the young chap. Actually, it will be very much helpful how to be a smart oncologist, according to the guidance of the smartest oncologist of the India, Dr. Charan Patro. Thank you so much.
Thank you, Dr. Arman. Thank you for joining. I mean, it is not academic. It was not academic talk, but when the people came from the post graduation, it will be a very useful presentation for them actually.
Yes, definitely. Beyond academic talk, it is very much needed that how to deal with the patient as well as with the in our clinical scenarios, with the journals, with the papers, with the society, how to deal. That is very important. Otherwise, we cannot defeat cancer.
Yeah. Thank you very much for appreciation. So I am sharing my email here. If anybody is interested to can call me, write me any issues, and I'm sharing my email, and my mobile is India. You can WhatsApp me this thing. If anyone to join the groups like task force groups or any form of PPT resource groups, you can email me, or you can WhatsApp me the things. I will help you till the extent. If you don't have any questions or any discussions, we can close the session. I request the client people to close the session.
Okay, sir. So Clinic is really glad to have you in this session today, sir, with these people around. And thank you so much for extending us the opportunity to host the session today. And I hope you all had a seamless experience with us. So with all your due permission, sir, we are concluding the session over here and looking forward to hosting you again. Thank you so much, sir, and bye and good night to all of you.
Thank you, ma'am. Thank you.